Sometimes we take reality for granted. Hi everyone, I'm Dr. Shruti Sharma, practicing psychiatrist in Delhi NCR area. And today, on the occasion of World Schizophrenia Day, I'm here to give you a brief regarding schizophrenia, in which people lose touch with reality. So basically, it's an important psychiatric disorder that consists of long-standing and chronic course. The most common age of onset is in the adolescent age group, and it requires long-term treatment, and it has a major impact on the physical as well as the mental health of the patients, and it leads to significant attrition in the social occupational functioning. So, what are the warning signs or when to suspect that a person is having schizophrenia? Is when we see a persistently altered behavior for 1 month or more, which consists of social withdrawal or the patient being aloof, alone, with the poor self-care, very shabby appearance, and the patient starts getting suspicious about the situations and people around him or her. The patient starts seeing inexistent things or hearing inexistent voices, and there is a sudden decline in the social and occupational functioning of the person. Now, if you may ask how common it is, well, around 0.8 to 1.5% of the people across the world suffer from schizophrenia. But how likely we are to get schizophrenia depends on a biopsychosocial model in which genetics is the main component. So, if we do have a family history of schizophrenia or mental illness in the family, then we are naturally at higher risk of getting the disorder. So the most common symptoms that we see are suspiciousness. The patient will feel that people are out there to get him or her or trying to harm him or her. The patient may experience hallucinations, which are seeing inexistent things and hearing inexistent voices, as a result of which patient is muttering to self, smiling to self, making bizarre acts in the air and having very long vacant stares. The patients may suffer from delusion, which are firm, fixed, false beliefs regarding people and situations around them. Then there is something called as passivity phenomena, in which people feel that some external agency is making them do the things they are doing or thinking the things they are thinking. People think that some external force is putting ideas into their mind. People think some external force is taking out ideas and thoughts from their mind. Or sometimes people feel that whatever they are feeling is being broadcasted to the entire world. And also, very common is the disinhibited behavior, in which people do not realize what is socially appropriate and what is not. So the question comes is, why does this happen? So it's because of disequilibrium of neurotransmitter dopamine in the brain pathways. And naturally, the treatment is with antipsychotic medications, which stabilize the dopamine levels in the brain and reduce the symptoms. Now, lastly, if you may ask why treatment is necessary, because it will cause schizophrenia, will cause a significant decline in the social occupational domains and will result in conflicts in the family, family disharmony, and relationship troubles. The person who is suffering from schizophrenia may be at risk to himself and at a physical risk to others under the influence of delusions and hallucinations, and it can cause a significant impact on the physical health as well. So, this was an attempt to create awareness about schizophrenia. If you know anybody suffering from schizophrenia who is not under treatment, please take an initiative to get that person to start taking treatment. Thank you.